Alright, welcome back to Midnight Med. This video will be on ectopic pregnancy. So when might you suspect an ectopic pregnancy? A fairly classic presentation would be where a woman of childbearing age presents with pain and or vaginal bleeding. She may also have missed her last period. Now it's important to remember that these alone can be signs of a normal pregnancy, so that's something to keep at the back of your mind. In addition to these signs, the woman's pain may often be unilateral, and it can be associated with abdominal tenderness or a palpable adnexal mass, and adnexal meaning around the uterus. It's worth noting that the incidence increases with age, and so there would be increased suspicion in women over 35. So how does an ectopic pregnancy develop? Well, it's where a fertilized egg implants outside the uterus, most commonly in the fallopian tubes. Other key sites might include the ovaries, the cervix, and the abdominal cavity. The diagram on the right-hand side illustrates some potential sites, with normal pregnancy for comparison. It often occurs after prior damage or alteration to the environment of the fallopian tubes. Things that could cause damage could include surgery or infection. Things that could alter the environment otherwise could be endometriosis and infertility-related issues. These things that alter the tubal environment are major risk factors for ectopic pregnancy. A particular infective cause to be aware of is chlamydia. It's thought to be responsible for 30 to 50% of all ectopic pregnancies due to changes that it makes to the tubal environment. Other key risk factors include smoking, increased age, previous ectopics, and previous abortion. That's either spontaneous abortion or planned medical abortion. Some red flags to be aware of would be sudden onset of severe and persistent pain, and signs of shock like tachycardia, pallor, and hypotension. Syncope might be observed in more severe cases. These things combined might be signs of rupture, a surgical emergency. The clinical examination is considered to be redundant in this case, and urgent resuscitation and surgical management are required instead. A laparotomy is performed to remove the affected segment. In order to investigate the symptoms and formulate a diagnosis, there are a few key investigations to undertake. A transvaginal ultrasound is essential. An example of an ectopic pregnancy on ultrasound is on the left here. A normal intrauterine pregnancy should identify an intrauterine gestational sac and a yolk sac around the 5 to 6 week mark. If this is absent, an ectopic pregnancy might be apparent as an adnexal mass, or it might be apparent due to the detection of a fetal heartbeat outside the uterine cavity. Free fluid, which is usually blood, may be observed around the uterus or in the pouch of Douglas. This, however, is not diagnostic for an ectopic pregnancy. Serum beta Hcg levels are an important indicator to check as well. If they are rising rapidly without an intrauterine pregnancy visible on ultrasound, this is highly suggestive for an ectopic pregnancy, especially if the beta Hcg level is greater than the discriminatory zone, which is the level above which an intrauterine pregnancy should be visible on ultrasound. A diagnostic laparoscopy can be performed where ultrasound is inconclusive. There are two main options for management of an ectopic pregnancy. Medical management uses methotrexate to kill cytotrophoblasts at the ectopic site. These cells are rapidly dividing cells at the implantation site. Methotrexate inhibits DNA synthesis and cell replication, thereby killing these cells. There are some key factors to be aware of that might impact the effectiveness of methotrexate as a therapy. It can fail if a laparoscopy has been done, if the initial beta Hcg level is above 2,000 milli-international units per milliliter, if the gestational sac is greater than 3.5 centimeters in diameter, if there is embryonic cardiac activity, or where free blood is present in the peritoneal cavity. In these situations, surgical management is typically preferred. Surgical management, as noted by the diagram on the left, is either a salpingostomy, which is making an opening in the fallopian tube, or salpingectomy, which is removal of the fallopian tube altogether. These can be done by laparotomy or laparoscopy. Another line of management is expected management. This is where a woman with a suspected ectopic pregnancy has low and decreasing beta Hcg levels. Levels of beta Hcg and progesterone are tracked over time as they decrease more and more up to a minimal level. If there is an increase in the levels of these factors at any stage, these patients are then moved to either medical or surgical management. So that's it. Thanks for watching. Like, subscribe, comment, follow us on Instagram for more, and we'll see you in the next video.